Thank you all for coming tonight. Janet Albers and I are going to tag team this a little bit. My name is Iris Wesley. I'm the Executive Director of the Center for Family Medicine. Couldn't be more excited about our new facility. There are a lot of people here that we have to thank for that, many people. I'm going to give a little brief background of how we got here. We started out 40-some years ago as a residency program. And we have been seeing underserved and underinsured people since that time. And about 2009, there was a groundswell of support from some community agencies and some of our collaborating partners, certainly our affiliated teaching hospitals as well, and asked us why we did not apply for an FQHC. So we looked into it, and again, FQHC is a federally qualified health center, and put our heads together, and we finally submitted an application in 2010. And what that application did was allow us, we were already providing good medical care, but the application allowed us to get a grant that allows us to do enabling services, things like behavioral health, things like financial counseling, community health workers, and Janet's going to hit a little bit more in detail about those programs when she talks. But we quickly, after we became a community health center, got 300 to 400 patients, new patients, a month. And we kept doing that for about 8 to 9 months and realized really quickly that we were out of space in our other facility. And we had to limit our new patients because of that. And then we started talking with our partners at Memorial and, of course, our dean and our executive dean, and said, you know, we think we need more space if we're going to see more patients. There was still a great need in Springfield for access to care. So this facility really is going to allow us to go from around 30 exam rooms to 60, several procedure rooms more. We have more counseling rooms. We have an acute care clinic, and all the enabling services. And just for those of you who might not know what family medicine is about, it is not only primary care, but it includes women's health, and we have a great number of our family physicians who do obstetrics. We do geriatric care, we do kids. We have the 340B drug program that allows our patients to get their medications at a low rate. We also have referral agreements for folks for dental, for optometry, for podiatry. This facility allowed us to go from about 18 providers at the time up to 35 now. We were at 24 residents and now 30. We had about 40 staff, and we're at about 90, 95 right now. So we've really been able to expand, and this facility will allow us to expand even further. So I'm going to let Janet talk a little bit here about some of the education.
Okay. It's so nice to see so many friendly faces out there and people who have supported us through all these years, and I appreciate you being here. One of the really wonderful things that we've been able to do being in FQHC is we've been able to get a lot of additional grant funding because we're in FQHC to provide all these enabling services. And there were 4 main ones I wanted to hit just really briefly. One is a medical legal partnership, and basically what that means, through Land of Lincoln Legal Assistance Foundation, we've been able to have Rachel Miller, who is a lawyer, here on site to be able to see our patients and work with them on their health-harming legal needs. And even more than that, she teaches us to recognize those needs so that then we can refer to her to get those met. And that's been really, really special for our patients. We also have been able to grow a whole team of care coordinators and transitions of care folks, which means, you know, the providers see a patient for a visit, but there's a lot of time between one visit and the next in the medical home. So we really need somebody who can have contact and interaction with those patients in between those visits to continue to move their care forward and meet any needs they might have, things like transportation or medications and the like. So we've been able to get expanded services grants for that too. And then community health workers actually is in collaboration with both of our hospitals and their community benefits sections, did a health needs assessment for the community and found that access was still an issue in Springfield with 2 FQHCs, with the hospitals, with the med school. And so they have started a community health worker program, which they placed here in the Center for Family Medicine. And then those folks are going out. We now have 3 community health workers that go out and see folks in the Enos neighborhood to start, and is now expanding over to Brandon Court and the like through CCHC. And then the last enabling services is behavioral health integration. And again, that's in collaboration with Memorial Behavioral Health, which they have been able to bring LCSWs, LCPCs here on site to see patients with us in our teams during a medical appointment. So we're not sending somebody away to be seen in consultation, but they're right here with us in the medical home. And if we have an urgent need, or even just as part of the intervention that we do of the day, they're part of that team that may come in and see somebody for smoking cessation, or maybe for depression, or maybe for pain management, all those kind of things. So we've really built a team that we're very proud of. What's that? And yeah. And one other that Iris was going to mention is we've been able to have a certified diabetic educator and nutrition folks on site that are really moving the dial when it comes to diabetes control. And that's been very exciting. In fact, Ann Daly and the folks now have us nationally certified as a diabetic education program, which is wonderful. And lastly, I really want to say I'm very thankful for all of the medical subspecialists that we have at SIU that have seen our patients in consultation. And soon in the old part of the building that's being renovated, they will be there to help us see patients on site, some of our patients in consultation. So that'll be great. And of course, what I was supposed to talk about as well is the educational piece, which is huge. I mean, that's really first and foremost what we're here for, is a residency program training our future workforce in family medicine. And all of our physician faculty, very uniquely as an FQHC, all of us are full-time faculty of the School of Medicine, and we're providers within the FQHC. And I don't think there is any other place quite like that that's an FQHC in the United States. Under the leadership of Dr. Brenham, our program director, we have 30 residents that undergo 36 months of training here, but we have a lot of other learners too. We have psychiatry residents that come over and rotate with us. We have medical students. We have physician assistant students with the PA program down in Carbondale. We have PharmD students and FNP students, both from Edwardsville, from the SIU campus. So we call this our hub of learning. You're standing within. And we know that the data shows that when people train here in this environment, they're more likely to go out and serve the same needs in their future practices. So that's why we do what we do. So with that being said, Dr. Randy Dunn, the president of Southern Illinois University, is here, and he is in charge of all the campuses here, the School of Medicine, the Dental School in Alton, the campuses in Carbondale and Edwardsville. And if it weren't for you and for the Board of Trustees, we wouldn't be here. Thank you very much, and I'd love to have you say a few words if you would.
Good evening, everyone, and thank you for that. Janet, you know it's tough to use this microphone. It's tough to follow Janet because she is so passionate about what she does. We had the opportunity a few weeks ago with the PA White Coat ceremony to have Janet at the Carbondale campus, went through the presentation of the white coats as the students were coming through. I was ready to sign up, quite frankly, as you talked to them. Very, very inspiring. On behalf of the SIU system and our Board of Trustees, it really is my pleasure to welcome all of you to this dedication ceremony today. It's so wonderful to see this reception area just packed to the gills. So if you're a community leader here in town, healthcare leader, our providers, staff, I know we have some representatives of our builders here, O'Shea. For whatever reason you're joining us today, we're really appreciative of that, and thank you for it. I need to take just a moment and introduce to you one of the real champions, not just of SIU Healthcare, the School of Medicine, but SIU in general. He's right here in Springfield, and that's our board chair, Randy Thomas. General, you're out there somewhere. General Thomas, wave your hand. Thank you. Jerry, as chair of the Board of Trustees, it's kind of like what you do trying to herd all those ducks and get them all in one direction, and he's masterful at it, and we appreciate your support. You know, whenever you have a dedication, ribbon cutting, something of this nature, it really is writing another page and moving us forward. In this case, extending that 40-plus year commitment that the school has provided, that we move forward around healthcare that you heard mentioned. So it's not just the issue of extending the reach of clinical care, but it's also the opportunities that you heard mentioned in providing medical training to so many more additional students. SIU is a community-based school of medicine. We see it here. We celebrate it here. We know from our accreditors and many other third parties we're among the best in the country in doing this work, so it's appropriate we all come here together to be part of this ribbon cutting, this dedication today. As you know, doing the work that has led to today and what is ongoing with healthcare in the School of Medicine really takes an incredibly dedicated staff. It takes folks who are committed day and night, literally, to the work that goes on. So, as you heard mentioned, it's not just this provision of basic primary care, but the nutrition services, the legal services, financial counseling, all the work that goes into an FQHC. Now, in the world that I used to work in, K-12 education, we talked about wraparound services. Now, that's been some number of years, and now the term you hear used is collective impact. And every discussion you have with funders, foundations, social service providers, it's all about collective impact. We're not going to find any greater example of that than what we're here celebrating today. And if you think about SIU as a system, this is what we try to be about. Everywhere we have a footprint in central and southern Illinois and literally around the state of Illinois, it's not just doing the one thing, but it's looking at wrapping around the support, the services, the cultivation of a region that we provide that becomes transformational for a place, becomes a game changer for a place. And you already have heard about how that has been the case here, and now even more so will continue. So congratulations to everyone involved. It's, again, so wonderful to see you all out here to celebrate. We couldn't get any better exemplar for what SIU stands for than what...
So I have been here about 30 years. Stint 5 years as a Memorial Medical Center employee. So what that means is I've been with the department a long time. And it was many years ago when we hired this young fellowship-trained family physician out of University of Missouri. And I was actually in the department, so I feel like I can say I hired this guy. He quickly went from an assistant professor to the residency program director. He was very active in the community in the hospital in Quincy, and then moved to Springfield to be the department chair, then moved up to the executive associate dean, and now dean and provost. I give you Mr. Jerry Cruz, Dr. Jerry Cruz. One other thing is he is known for his riddles, and I am known for my hats, and so when we get together at retreats, it's quite interesting.
Yeah, it is for sure, Iris. So, and I came 32 years ago. So, and you were here, right? 32. Yeah, 32 for me. Yikes. Anyway, when U.S. President Richard Nixon was in France at the funeral of Premier Charles de Gaulle, he said, "This is a great day for France." Well, it is an election year, I guess. Actually, we have a greater reason to say this is a great day today for the people of Springfield and Sangamon County as we dedicate this new facility here. This is another step forward in the partnership of the SIU School of Medicine, the Center for Family Medicine, and Memorial Medical Center to have better healthcare education, better healthcare access and equity, and better health for the people of Springfield and Sangamon County. It was in the late 1990s that we really started going down the road of a process called community-oriented primary care. And we discovered at that time that our mission and the mission of Memorial Medical Center was virtually identical at that point, of assessing the needs of the community and building programs, facilities, and the people that were necessary to achieve those goals. And then, in about 2005, a pediatrician from the Johns Hopkins Bloomberg School of Public Health, Barbara Starfield, put her research together with that of the entire world and described the characteristics of healthcare systems and healthcare practices that improved outcomes, lowered costs, and improved equity and access for all. And so we immediately wanted to put those in the Center for Family Medicine in everything we did. And the folks who have already talked, Janet and Iris, were right on the front lines for that. But that was first contact access, patient-focused care over time, comprehensive care, care coordination, and then providers who had a commitment to families, to the community, and were culturally competent. So though all 7 of those things were shown to do all of those things. So that's where we got our triple aim +1, effectiveness, efficiency, equity, and enjoyability. And so that's the road we've been on for that time. After that, then we wanted to become certified so that we could enjoy the benefits of that certification. So we became here a level 3 patient-centered medical home, the highest level given by the National Committee on Quality Assurance, and that naturally led to what Iris described, the application for a federally qualified health center and all of the requirements and all of the benefits that it brings to bring truly comprehensive and truly coordinated care to the people in this area. So my hat's off to everybody who had something to do with this. This, again, is a great sign of the partnership of Memorial Medical Center and the Center for Family Medicine, for sure. And under the leadership of Iris and Janet and Carriana Brenham, Michael Dinda, Harry Lawson, the other faculty that you see on the screen there, the residents, the staff, everyone who provides care, this is a great day for everyone here. So I just give you my congratulations again.
Okay, now I'd like to introduce Ed Curtis, the president and CEO of Memorial Health System. I've known Ed for nearly 20 years, and I remember interviewing with him when I came to Springfield. And I remember saying at that time, if we're going to grow in family medicine, we're going to need a new building. And we were then at the old Doctors Park down on Walnut, I think. And within 18 months, we made our new home here at 4th and Carter, thanks to partnership with Memorial. Then as we became an FQHC in 2012, as Iris already said, it became really obvious very quickly that we were outgrowing the space again. And I know, Ed, you probably got really tired of me saying, you know that space in the grassy knoll that we went in, didn't I? Multiple times. And here we are. And I just want to say from the bottom of my heart, thank you, thank you, thank you for your partnership, for all that you and Memorial Health System do for the health of our patients, for the community, and for the region. And I'd like for you to come up and say a few words, if you would.
Thank you, Dr. Albers. Good evening, everyone. It's great to see so many people here this evening. We're just greater together. And I think when you look at our partnership with SIU School of Medicine, we look at the university, SIU, we look at Center for Family Medicine, all of us working together, we can just accomplish so much more. 6.5 years ago, our president signed the Affordable Care Act. And what was the objective of the Affordable Care Act was to treat more people, provide more people access to health care. It was to do it at a lower cost, but raising the level of quality and safety of those individuals. I can't think of a better example of implementing aspects of the Affordable Care Act than the work that's being done by our medical school. To Chairman Thomas, President Dunn, you have an amazing medical school. I tell anybody that will listen, this is a national treasure, a national treasure. The partnership with Behavioral Health and Memorial, Jan Gombach, our President and CEO of Memorial Behavioral Health. We're excited about our new Chairman of Psychiatry, Kari Wolf. But when you look at the faculty in this department, and all of you are here today, our Residency Program Director, Dr. Brenham, and all the faculty that are here to train the next generation, but more importantly, to care for those individuals, it's so easy for us at Memorial to reach out and do a little bit more to help SIU School of Medicine. And I just am so happy to have this facility open. One additional group that I want to thank is I want to thank BSA Life Structures. I see Rob Scheck here. I don't know if you have other people from your organization, Rob. I'm sure, yep, all your team there. Thank you for your architectural design. Mike O'Shea, I know, is here, and his team from O'Shea Builders. Mike, thank you for being here. Tyler, Carmody, and the team that's here, Corey, others. I can't thank you enough because this is about partnerships. We work with our architects, we work with our contractors. We don't bid stuff. We develop strategic partnerships, and they care as much about the patients that are here as we do. And that's what I think makes this special. And so we're working on renovating the back part and cleaning up the outside, and that'll conclude on time as scheduled. But Dr. Albers, I just can't congratulate you and Iris enough for your passionate dedication to the mission of the organization of the medical school and what you're doing for patients. Dr. Cruz, we couldn't have a finer dean and provost of SIU School of Medicine. Absolutely could not have a finer. But I have one concern for our dean and provost. We have a chairman of the board, the first name of Randall. He hires a new president of the university named Randall. Then I just see my alma mater at SIU, Edwardsville, has a new chancellor named Randall. So I'm going to take my friend Jerry downtown, and we're going to get a new name, and it's going to be Randall Jerry E. Cruz, MD. No, and all kidding aside, I want to congratulate everybody, because it's not just the names that I named, it's everybody in this room that is passionate about the care of the people that we serve here, and I couldn't be prouder to be here today. Thank you.
So we couldn't have done a lot of this without our own board, our board of directors. And I'd like for all our board members to please stand. Would you please come up front? Would you please come up front? Please come up front. As they walk up here, this is Peter Cadwell. Brad Billings, who represents our Quincy area. As you know, we're now at FQHC in Quincy as well. Our board president, Beatrice Crawford. Jan Gabnock is our vice president. Stephanie Standish represents Public Health Department, and Drew Lobmaster works for the school district. So if you give them all a hand as well. I'm sorry? Yes. So this is 6 of the 14 board members, and many of you may not know, but we do have to be 51% patients. Our board members do. So some of these folks up here are patients as well. The other thing, I wanted to recognize our partnership, our recent partnership with many of the public health departments. We have Cass County here today. We're doing partnerships with Morgan County. We opened in Jacksonville. We're doing a partnership with Lincoln County as well, Logan County in Lincoln, and Sangamon County Health Department. So it's a natural kind of marriage with health departments and FQHCs. So look for some more FQHC clinics in the future. Right now, the weather did not cooperate with us, so we want to do the ribbon cutting, but we're probably going to go back here and do it. So all you have to do is turn around. We're going to do it in back where our sign is.
Lift it up. Good. Okay. Okay. Tell us when we want to stand.
Okay, I'm ready.
Do a count. 1, 2, 3.